Confused about what career to choose? Not quite sure of the range of study and work options compatible with your personality, aptitude and interests? Welcome to Career Cafe for a ringside view of an exciting career each week. Together, we shall explore the pros and cons, the ins and outs, the programs and prospects, all the stuff you need to make an informed and successful career choice. Hi, I'm your host and career guide Parveen Malhotra, and on the menu today, we have a very interesting field, careers in public health. India is saddled with one of the highest disease burdens in the world, which in the long term could prove to be a major stumbling block to our economic and overall development. The acute shortage of public health professionals to address our major public health concerns like chronic and new infectious diseases, toxic waste, health problems of infants, mothers, senior citizens and the impoverished further compounds the problem. There's a worrisome dearth of trained healthcare professionals in preventive and social medicine in the country to address these issues. And to tell us all about public health, the science and art of preventing disease on a large scale, prolonging life and promoting health and efficiency by organized community effort, we have with us Professor Sanjay Zodpey, Vice President North and Director Public Health Education at the Public Health Foundation of India, New Delhi. Besides heading the Indian Institute of Public Health, Delhi, as Director, Professor Zodpey is also adjunct faculty at Georgia Southern University, University of North Carolina at Chapel Hill, USA, and Honorary Professor, Sydney Medical School, University of Sydney. A physician, public health specialist, and epidemiologist by training, Professor Zodpey has been involved in several national and international research initiatives that have contributed significantly to the field of public health. Welcome to Career Cafe, Professor Zodpey.
Thank you, actually. It is indeed my pleasure to be part of the show.
Oh, I'm so glad you're here because I couldn't think of anyone better than you. Talk to us about this field. There is such a dearth of people and yet there's so little known about it.
Yeah.
And I hope that in the course of this program, we are able to shed at least a little light.
Yeah,
on,
certainly.
Yes. So tell me, what all, when we talk of public health, what all comes under its purview? How much of it is medical and how much of it is allied medical?
Very interesting question to begin with. I would say that, and you rightly mentioned actually, it's a science and art. It's a science and art of preventing disease, prolonging life, and promoting health and efficiency in much more organized efforts. That's what all public health is all about. When we talk all public health all about is good sanitation, providing clean environment. It's a prevention of communicable and non-communicable diseases. It's teaching people actually to improve upon their health through health education. It's providing healthcare to the people actually to say that early diseases are being detected and they are treated well. So public health is much more broader actually, and at times people get confused with because of the word health with medicine.
Absolutely, absolutely. But and I think in a way it's understandable because in earlier times public health was part of community medicine as in medical colleges only, no?
Yeah. So what actually the medicine is, but public health is truly sense in actually a multidisciplinary discipline, and we many times say that public health is a discovered discipline.
Yes,
it's a fusion of several disciplines actually. It's not only the medicine, because medicine is instrumental and critical and important in a larger gamut and context of public health, but there are several beyond health measures which impact our health, which contributes to several conditions.
Even traffic.
Yeah, of course.
Yes,
Yeah,
even
that's
something so unrelated, but yes, related.
Yeah, that's true. And so environmental health, occupational health, and so there are several factors and facets basically, and therefore we say that it's multidisciplinary, and therefore physicians of course have important place in public health, but we also need to see that non-physician background people actually enters into the public health and contribute in advancing the agenda of public health.
Very true. true, very true. So who are, so let's talk about the medical specialists everyone knows about.
Yeah,
so
yeah.
we will not touch upon
Yeah,
that. I mean, they are an important part of the system, but that's well known. Who are the others besides the doctors?
Yeah. So let me tell you a prelude and little bit of a background, actually beginning with the medical profession, because see, the community medicine or the preventive and social medicine is a part of medical profession, and traditionally public health in India was taught through the medical schools for medical doctors and by medical professionals. We as professors taught actually community medicine, but in last couple of decades, I would say, the public health has moved outside the corridors of medical schools, and you could see that opening up several institutions providing programs related to health and hospital management, even several institutions offering programs, masters in public health, that's MPH program. It's a flagship program in public health that is being offered now more than around 3 dozen institutions in India, and even specialized programs in terms of public health in epidemiology, occupational health, and even related to the health promotion. So there are several disciplines in context of public health. New programs and new institutions came into a field which offer programs for non-medical background people, and the admission criteria of these all courses is a little bit variable. Mostly the science graduates, arts graduate, or rather several programs, MPH programs, any graduates can apply actually. So there's a much more wider application available, and it's available for anybody actually. Anybody today, a graduate in suppose social sciences wanted to join a program, it's open. If the graduate in management or engineering wanted to join public health programs, they can very well join programs. And as I mentioned, actually public health is a discovered discipline, and therefore it has several facets into the program. Like for example, suppose health informatics. So now health informatics, the engineering graduates can join health informatics program. The biotechnology graduates can join clinical research programs. So that all contributes to the public health.
So if you have any questions on this fantastic multifaceted field, please call us quickly on our toll-free numbers, and Professor Zodpey is here to answer all your queries. Yes, please continue.
Yeah. So I was mentioning that in public health there are several disciplines which is a fusion, and then that translates to the public health, like occupational and environmental health, management, social sciences. So the background of the management and engineering graduates can join the public health programs, because we need people trained in management in the context of public health. Veterinary public health for that matter, it's important. Today we are experiencing several infections which originates from animals, zoonotic infections, and recent outbreaks of several conditions, actually bird flu and actually are zoonotic infections. So there is a very important role for the veterinary public health. So even the veterinarians are important in public health. For example, economics, the social sciences, the economics background. Health economics is a very important discipline of public health. And we need people trained in health economics to understand which interventions are better, because there are multiple interventions available and which are more cost effective that we wanted to see. So the health economics discipline is there.
So what does a biostatistician do?
Biostatisticians are extremely important, because biostatisticians are involved in data management and analysis of the data that is related to the health. And they also have a very important role to play in research, the health research, medical research. There's a lot of research in public health. Biostatisticians' role is extremely important for planning of the studies in terms of what sample that you would take, then recruiting those subjects into the studies, and then actually performing the study, and then collecting the data, then analyzing the data, interpreting the data. And because everything relates to the data and information basically, and in that context the role of biostatisticians and data managers is extremely important in public health. Now statistics is it's itself in the science basically, so that applies to the biological sciences, either biostatistics and people call it some medical statistics, health statistics, biostatistics, all are same actually. Some differences could be there, but it's very important discipline of the public health. Public health nutrition for that matter.
Yes, what a big area, absolutely.
The country has experienced and is experiencing several public health problems related to the nutrition. So we need people trained in public health nutrition. So then public health nutrition is a fusion of nutrition as a discipline and public health as a discipline basically. So applying that to the context of the public health is a public health nutrition is an important area that is critical for the public health.
And even education, I mean, public health education, I mean, Educating. So there, what kind of people?
The health promotion. Health promotion is extremely important. Health promotion and health communication. What happens is that we need to communicate with the people. We need to tell people actually. So imparting health education itself is a strategic basically. It's not just that we tell people and people who do that actually. If somebody is smoker, it's not just you tell him that there are the hazards and bad effects of smoking and you quit smoking. It's not going to happen that way actually. So there needs to be a very scientific approach to actually creating messages, communicating with the population, because in public health the whole focus is population basically.
Absolutely.
So in that context, the health promotion, communication, behavior change messages that you wanted to give to the communities are extremely critical and important. And in public health, this advocacy with the communities is extremely important. In that context, we need people who are trained and who have these competencies and skills in the context of health promotion and health communication.
What a multifaceted field this is, really, really. So, but tell me, what is it like working in this field? What do you need to keep in mind? Now, say you, when you studied medicine and then moved to community medicine and this, I mean, who should go in for actual practice of medicine and or otherwise public health?
Yeah. So I would say that in medicine, actually, you treat patients. That as a doctor, we treat people.
Just a sec, Professor. There's a caller on the line.
Of course, please.
Yes, welcome to Career Cafe. Hello.
Yes, ma'am. हम पूछना चाहते थे कि हम चश्मा अपना छोड़ना चाहते हैं
जी,
तो उसके लिए हमको क्या करना पड़ेगा? पावर 0.5 है मेरा।
कौन सा साइंस?
क्या सर?
आप क्या जानना चाहते हैं?
सर, चश्मा अपना हटाना चाहते हैं, मेरा पावर 0.5 है।
हम इसी के बारे में जिक्र कर रहे हैं अभी कि पब्लिक हेल्थ का जो डोमेन है उसमें तरह तरह के लोग आ सकते हैं, साइंस से भी आ सकते हैं, ह्यूमैनिटीज से भी आ सकते हैं, कॉमर्स से भी आ सकते हैं और मेडिसिन से भी आ सकते हैं। तो अगर आप थोड़ा सा टिके रहेंगे इस प्रोग्राम के अंत तक तो आपको पूरा समझ आ जाएगा कि क्या 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 मैं इधर आने के पहले पढ़ रही थी कि देयर आर मोर देन 45 different roles that are at least those that were listed in this field. तो और उसमें लेवल्स कितनी होंगी हर रोल के अंदर, तो इतनी सारी आवश्यकता है इस फील्ड में। तो अगर आप प्लीज ध्यान से सुनेंगे तो आपको सारा समझ आ जाएगा।
So I was mentioning about, you checked with me about the field of medicine and field of public health.
Yes.
In the field of medicine, as a doctor, we treat one individual patient and patient recovers and we get immense satisfaction actually because the patient is recovered, we saved the lives actually. In public health, the beneficiaries of public health are nameless and faceless. But what happens is that suppose you are working in the field of vaccines, you develop vaccines or even implementation, you give vaccines to so many people actually. So you don't know exactly who has benefited out of that, but several lives would be saved because of the giving of the vaccines basically. So in that context, your contribution is much more larger. And that gives you immense satisfaction of contributing to the social cause.
Absolutely, absolutely. So actually, I've also read about clinical research, which forms a part of many of the programs in public health. Does that strictly come within the purview of public health?
I would say that clinical research initially, like, it was more focused on actually engaging research methods in the context of clinical medicine, trying to understand that how do we do better research in the context of clinical medicine. But now with the vaccines and even the pharmaceuticals, basically everything contributes to the public health finally, because even the clinical research would help us to undertake some clinical trials through which we would be able to identify which drugs have better efficacies, which drugs work, which drugs do not work, which drugs are better than other drugs or vaccines, and all they contribute to finally betterment of the people actually. So if you see a larger context, I would still say that all these fall under the domain of public health.
But say now within your field of this wide umbrella field of public health, acute shortage is in which areas? Which are those areas that need to be addressed immediately?
Yeah. So I would say that actually public health, if you look at this as a profession, and it's not like medicine or law because it's a single profession. In public health, you need entomologists, you need health economists, you need health managers, you need experts in the field of occupational health, you need people trained in environmental health, you need people trained in public health nutrition. So it's quite variable. However, I would give an example as a part of the occupational health. In industrial setup, as for the factory's rules, it is important to have the factory medical officer. And in India, currently we have around approximately 7,000 plus factory medical officers. But if you look at the requirement, it's almost to 17,000 factory medical officers are required. So there's a strict deficit of around 10,000 occupational health physicians which are required in this country to work in industrial setup to provide occupational health care.
Did you hear that? Did you hear that? I mean, what a fantastic thing that you've told us. There's a caller waiting on the line, Ashish from Chennai. Welcome, Ashish. Hello.
Hello.
Hi.
Yes, ma'am. Actually, I'm from Pune.
Okay, sorry.
And I want to ask Mr. Zodpey that, are there any steps being taken towards publishing the materials online? क्या मैं ऑनलाइन खुद जाके पढ़ सकता हूँ जैसा मैं कोई अभी कॉलेज में
हाँ, बिल्कुल 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 आपका सवाल.
It's a very interesting and important question. There are several now online programs being also developed because, as I mentioned, actually public health as a discipline evolved recently in this country, and there are several institutions which offer on-campus programs.
Yes.
But people who are actually on job or they are doing some other programs, if they wanted to join for online programs, now I would say that more than 50 programs in e-learning mode, in a distance education mode, are offered in India. And in various domains of public health, you would find that programs in epidemiology, management of reproductive and child health program, health promotion, public health nutrition, even hospital and health management. So all these domains, we have online programs available where at times there are a couple of contact programs at 1 week or a couple of weeks actually, but otherwise mostly these are online e-learning programs.
But are these as equally accepted by the industry?
No,
what should you keep in mind? What should you keep in mind while...
I would say that they may not be equally actually as compared to, like, suppose if you do MPH program on campus and if you do postgraduate diploma in any of these programs through on-learning, so that may not be equated. But what happens is that suppose you have a background in social sciences and you wanted to build your skills, so it's a value addition that happens actually,
that's right.
And if you, even if you are MPH and you join as a district epidemiologist in National Health Mission, but if you do an online program in epidemiology, that brings additional skills to you.
Perfect.
So because nowadays it's more important, I would say, for young graduates, I would also say that beyond your qualifications, it's also important that what skills and competencies that you have.
Very true, very true. And Professor Zodpey, we'll discuss this specifically after the break. We'll take a short break here, but when we return, we'll continue to look at the outlook and prospects in public health as well as take your queries. So stay right there. Welcome back to Career Cafe. We are looking at careers in public health, and with us is Professor Sanjay Zodpey of the Public Health Foundation of India. We have a caller waiting on the line, Professor. So let's go on to him immediately, and then we'll continue our discussion. Welcome to Career Cafe. How are you?
Oh, good evening, madam.
Yes, good evening.
I'm Ranganath from Tamil Nadu.
Yes.
Good evening, sir. My question is, I have a cousin who's doing dentistry.
Right.
So when we see the post-graduation, there is a course called Public Health Dentistry. So is it related to public health in general? And what is the scope of public health dentistry in India?
Fantastic question. Preventive dentistry and public health dentistry. Yes.
Public health dentistry, and in some universities it is also called as community dentistry, are important because we recognize that oral health in the context of the community and with population focus is important. Lot of tobacco chewing practices in this country actually contributing to the oral cancers and several oral health related problems. And in that context, community dentistry and public health dentistry dentistry has important role to play. But I would also suggest even the dentist background colleagues who can also explore even broader context of public health beyond community dentistry. And a lot of dentistry background students after graduation now joining MPH programs, and not restricting to only oral health, but widening the field actually, and overall getting into the public health. And of course, because of their dentistry background, they can still pursue their interest in oral health.
Yes, that's a fantastic suggestion. Yes, absolutely. That dentistry तो किया ही है, और अगर आप masters in public health program करेंगे तो dentist, yes, in context broader हो जाएगा. You get the point? Yes, so now we are talking about dentists also coming into this, being a part of this. So what is, I mean, we are talking about dearth, acute dearth of professionals in this field. What is the requirement? How large is this requirement?
Actually, it's a need and demand paradox in the sense that because our country is a big country and we need people actually in huge numbers.
Right.
So if you look at the need of public health professionals in each of these disciplines, you take an example of occupational health or health management or health economics or entomologist or any other professionals basically which are important part of the public health. But if you look at the demand, at times there is the issue that where do we find the jobs. So what we did is that, and there have been some studies carried out in this country to understand where are these requirements. And McKinsey had done one study a few years back where they had calculated the requirement of public health professionals, as they put it at somewhere plus 10,000 public health trained people are required in this country.
Every year?
It's almost actually they calculated over a period of time basically for that point in time.
All right.
We did some studies with World Health Organization where we had calculated that it's 10,000 plus professionals are required actually in public health system, but additionally we also require 2,500 to 4,000 professionals to serve the NGO sector.
Oh yes.
Because NGO sector, there are a lot of initiatives in the context of public health where people trained in public health are required for the NGO sector. Similarly, for several international organizations and UN organizations, they are working in India and they need people trained in public health. We calculated that around 1,000 to 1,500 people are required that way. So if you look at
and CSR.
And CSR now, because the corporate social responsibility is actually, and generally their engagements are seen in the field of social sector or education or public health. So, and a lot of CSR initiatives have started employing people having MPH graduation background actually.
So that's a fantastic area to look at. We have one caller, last caller from Ahmedabad. Welcome to Career Cafe. Hello.
Hello.
Hanji.
Hello. Good evening, madam.
Good evening.
Madam, myself Dharam Patel.
Hanji.
Completed MSc Nursing in Gujarat.
And
I want to ask you, sir, what is the scope of public health in nursing? And nowadays, so many nursing field, the girls population is more. So that is what is the scope regarding public health?
Yeah,
again, very good question. We would have missed out this point. बहुत सारू था तो मैं पूछूं.
Very important. And I would say that for several of our programs, in fact, a lot of nursing graduates are joining public health programs, and they are doing fantastic job. I know personally several nursing graduates who have joined MPH programs, and after MPH program, they went for doctoral program. They did their PhD in public health, and they are doing fantastic job. So I would say that at times nursing graduates feel that there are now several nursing institutions in India and a lot of nursing graduates, and there is an employment issue also after graduation. So I would say that public health is the field for them.
And particularly him, Mr. Patel, because he's already done his master's, so he has an academic bent of mind, obviously. So for him this field would be fantastic.
Very good. Yeah.
And then what would he be doing then? Then he would be like any other public health professional.
Yeah, Miss, like there are options. Either you can be a general public health professional, you do your MPH.
Right.
But while doing MPH, you might find that, you know, I like health economics, or I like social and behavioral sciences, or health promotion, communication, or health management I wanted to do. So in public health, then you can specialize further actually. You can do a PhD program. You can go for PhD program or doctorate in public health. That is called a DIRPH such programs are also available. And now, as I mentioned, that there are several institutions in India offering these programs, and they need, as a faculty, PhDs.
Yes.
And unfortunately, there are a very small number of PhDs in public health in this country. So I think for those MPH graduates, there are much more wider opportunities that they can also enroll for PhD programs subsequently.
So tell us a little about the programs in public health that are offered in India. You have the Public Health Foundation of India. Under that, you have the Indian Institutes of...
We have, like, Public Health Foundation of India is mandated to create Indian Institutes of Public Health, and we have now 4 Indian Institutes of Public Health based in Delhi, Gandhinagar, Bhubaneswar and Hyderabad, and our Shillong institution would be operationalized soon. We also have a center in Bangalore that we started program, and through these institutions we offer long-term academic programs. These are postgraduate diploma programs, postgraduate diploma in Public Health Management, postgraduate diploma in Biostatistics and Data Management, postgraduate diploma in Health Economics, Financing and Policy. So several of these postgraduate diploma programs. But I would be happy to announce that this year we also launched MPH programs from our 2 institutes in Gandhinagar and Hyderabad. We have now Masters in Public Health program.
So that's a degree.
That's a master's degree program.
Okay.
And currently we also have 2 MSc integrated PhD program. That's MSc Clinical Research Integrated PhD that we offer from Delhi, but from Hyderabad we have MSc Health Informatics program. That's an integrated MSc plus PhD program, and we also then have certificate programs in Associate Fellow of Industrial Health and some basic programs in the context of short-term programs in public health. But we also have several online courses, because we realize that several colleagues who are working as a part of the health systems, they are not able to spend time for on-campus programs actually. So we have 1-year postgraduate diploma programs in epidemiology, health promotion, health services management, public health nutrition, so all different domains of public health. We have 16 programs in, in various
and I
domains
think so the thing to do is for students to come onto your website and take a look at the offerings that are available, and then see where, you know, your heart
the Public Health Foundation of India, they can Google and then,
they can Google and get all that.
Get a lot of information on that.
Super. Thank you so much for coming to Career Cafe, Professor Zodpey. I think you opened up, you know, in a country where unemployment is rife and people are looking at new avenues. You've really talked about a field that offers not just an employment opportunity, but an opportunity to do good on a large scale, not benefit one person, 2 people, but very large numbers. So I think on that note...
Thank you so much. It's my pleasure to be around and talk about public health, because we strongly believe in the field of public health. And
yes, I know you're so passionate about this field. And so with that, we wrap up today's show here. Next week on Career Cafe, we'll look at yet another career. But before that, let me leave you with a thought. To attain great heights, you need to cultivate great depth. So bye for now and be your best.